Thanks, Dr. Vijay. So every year, Dr. Vijay and Dr. Kumar taking this lead of these workshops, lung cancers, and this we are conducting the biostatistics or statistics workshops. And I'm very much I'm privileged to be here and present some concept of this topic. And welcome to you all. So today I am going to say about something about the confidence interval and credible intervals. I know that many of you are heard about this term called confidence interval and quite often use this terminology. And as compared to confidence interval, another terminology quite often used that is called p-value. So as compared to p-value, the reason for this presentation is that to make much more robust way to do the analysis, make the clear concept about the analysis. And there are so many things happen behind the analysis. It's not only this running the software or getting the result, putting data, running the software and getting result. It's not that. There are so many conceptual things are based on that. We do the analysis and get the results. So things are there. We try to put 3 levels of over, try to make this, overcome these applications of p-value and try to make it as much as possible to be taken by confidence interval, and second level is as much as possible try to reduce the applications of confidence interval and taken care by the credible intervals. So these are the thing. So confidence interval, why it is coming black now? The PPT, PDF could you open? The title would be there then. Okay. Make it as a full view, then it will come probably. Yeah. हाँ मैं बैक में yes make it big click on this plus sign, it will be bigger. Otherwise you could open by Acrobat DC, then it will be okay. Don't make it from this Microsoft. You must be having Acrobat DC, then open it through Acrobat. Open it through PDF. Okay. I put my computer here? Can I put my computer here? Huh? Okay. Okay. The next one I will put my computer there. Okay. See, the confidence interval that you must be having here so many times, and this one is based on the frequency approach. Frequency means we take this count and number, and after that we use or this number to generate the confidence interval. So, for example, one example, a nice example could be if you want to have the let's say the diabetes rate we want to see. We want to have the diabetes rate. So, diabetes rate comes in terms of the percentage. Then comparing the percentage, formulate it, and once having the percentage, then also along with the percentage, another thing always we get. This is called standard deviation. So, we manipulate this confidence to get the confidence interval. We put this percentage along with the standard deviations, and we can easily get the confidence interval. So, anyway, it's based on the frequency approach, a range of value that either contains or does not contain the unknown parameters, and quite often we consider as a 95% confidence intervals. It's quite known that every time we say, and p-value as an alternative of 95% confidence interval, we say the p-value is the 0.05. So, we say, you may see that might be seen in many manuscript. It's let's say the p-value less than 0.05. So, it is a 0.03, 0.04, then we say it's a significantly different. So, significantly could be considered as a if you consider p-value as a 0.1 also, in that sense confidence interval will be reduced, and then confidence interval will be 90% rather than 95%. So, same thing happens. So, we are having a choice. So, if we keep on increase our confidence interval, our area of p-value will reduce, and making that significance quite stringent criteria. So, getting it is quite easy to get with 90% confidence interval, and simultaneously where p-value is 0.1, means if we are having the 100%, split the 100% as a 90%, rest persons are 10%, these 10% converted as a into 0 to 1 scale, and then p comes as a 0.1. That's the way. So, if you are having 100% confidence interval is 95%, so rest person is 5%, then 5% you will be rescaling it to into 0 to 1, then it will be 0.05, and below that we say it's a significantly different. So, drawbacks of that, 5% of the time the confidence interval can be close or very wrong, and it's quite difficult to interpret. One of the ways that you might think that, oh, why it is difficult to say or make the interpretations, but the conceptually it is not always correct. Reason behind that, every time we are using this confidence interval concept, we are thinking that whatever the sample we are having, that is extrapolated and it's a representative of the populations. And thereafter we are trying to draw the conclusions and say that 5% confidence intervals and whatever the results are there. So, I will come, the next slide I will come, there's meaning of this, how to make the confidence interval on that, and after that I will go with this credible interval concept. So, there are some conceptual drawbacks of there in the confidence intervals or along with the p-value. This comes together, confidence interval and p-value comes together. So, there are some conceptual error, but unfortunately since long back 1920 that R.A. Fishers established this confidence interval concept or p-value concept. And the credible interval concept became long back, 2050 years back with the Bayes theorem. But since this era, 1920s and thereafter onwards, we are not having very much computationally intensive things, or we are not having very much computational flexibility. So, we couldn't perform this Bayesian interval or the Bayesian way to calculate the analysis or getting the credible interval. So, credible interval will come, the credible interval come in the era of the Bayesian. So, slowly it was so easy to calculate. So, entire markets were taken by the p-value and confidence interval concept. Now while you are having so many way to calculate credible interval, now it's becoming very much challenging to avoid this confidence interval and p-value concept, because people are having mindset to consider the p-value and confidence interval. So it's become quite reference range now, because so many publications, so many articles been done on this confidence interval and p-value. So now this idea is breaking that idea is quite challenging, but we are trying to make it over there. So this is the conventional approach or conventional way to consider the confidence interval. So see, when we are talking about the confidence interval, so while we are talking about the confidence interval, we will be having some data. Why we will be having some data? Because the data we are trying to understand what is our ultimate thing. So let's say for one good example, like when we were talking about that vaccine trial. So vaccine trials were taken only, let's say, for 11,000 people, given to 11,000 people vaccines, and out of that, what was the success of that vaccines were there? Based on that, we assume that, so that will be equally effective to the entire world or entire populations. So blindly we started to giving crores and crores people to the vaccine. So based on the 11,000 populations sample data, we assume that the same thing is going to happen for entire world, and then only we approach it. So while we are talking about the sample data, we think that the sample data will be equally representative of the population's data or population's characteristics. So what the characteristics of populations lie? The populations lie with this, there's very well-known curve called bell-shaped curve or Gaussian curve or normal curves. So any kind of populations data you look, it is supposed to follow this bell-shaped curve. So while we are talking about the vaccine, so you would think that somehow it will be effective, somehow it will be not effective, and ultimately it will be going for populations in this bell-shaped curve. Any example, you talk about the diabetes rate, you talk about the cancer rate, anything you say, it is supposed to, it will follow this bell-shaped curve. Now while we are having the bell-shaped curve, this bell-shaped curve can be considered like we are giving one group of people one kind of therapy. Let's say we are giving the cisplatin, another group of people we are giving the cetuximab. Now we are also thinking that these people will also follow the same characteristics or same populations characteristics after giving the drug, and simultaneously we are also expect that that should be different. That's the meaning of the one drug over another drug. So that we will assume over there. So if both type of population, those are given the cetuximab or cisplatin, if both of them are similar characteristics, then their bell-shaped curve are going to be overlap with each other. If they are different in terms of the effectiveness, then this bell-shaped curve should be different from each other. They will be far from each other. So one will be here, another will be in right side. How far they can be in right side? If they cross that 2.5% last that region, right side that region, if they cross and goes beyond that, then we are going to say that if it is a cisplatin arm, then cetuximab are having different outcome of different kind of effectiveness. It may be higher effectiveness. Or it may be another way, if the cetuximab outcome is come left side, then we can say cetuximab arm's characteristics or effectiveness, those are treated with the cetuximab, is completely different than cisplatin arm. But if they both overlap with each other, then we are going to say both having equal effectiveness. And by how we are saying, it's based on the sample data we are talking, and we are talking about an entire world or entire country. If you give cetuximab or cisplatin, this kind of results are going to happen. And this p-value or confidence intervals lie within this range, blue to blue. Blue line to blue line. That's the confidence interval range over there, stand over there. But one lacuna of that terminology is that we are going to consider, we are going to assume that these people are going to be represented, extrapolated. The sample data we are going to extrapolate it in hypothetical scenario and going to say these people are going to have that characteristics. And that's why the limitations, so that is not correct, because the sample you are having, that cannot be similar characteristics in Mumbai, the similar characteristics we may not get in the Chennai population, Chennai people, but still you are assuming by extrapolation. So that's the limitation of the confidence interval. But as an alternative of this confidence interval, the credible intervals exist that stand with the Bayes theorem. Long way this Bayes theorem given, but that was in theory. But while we are talking about to bring this theory, then it's come the very attractive way to make the presentations or make this analysis very attractive. So unknown parameter is a random variable and its bounds are fixed, increase interpretability. So here what happened, I'm not going into details about the formula, but it's based on basically the condition probability. So we are putting one conditional probability and simultaneously we are asking our data to follow a particular distributions. In earlier cases, confidence interval, we don't know how kind of data is following the distribution because we are assuming it is going to be follow particular normal distribution and based on there its n. But here we are putting one conditional probability. Along with that, we are asking our data to follow certain distribution and based on that we are trying to make. One example is given, like it's a diabetes rate we are talking. Now, if we collect some individuals data, let's say we are talking about 300 individuals and out of that we found that 45 people are having diabetes. So around 15% people will be having diabetes, correct? But while we are talking about the diabetes, every individuals will be having equal chance to having either diabetes or non-diabetes. So out of 300 people, do you have diabetes? Do you have diabetes? By checking their blood sugar level, we are assuming that everybody will be having equal chance to having either diabetes or non-diabetes. So in that sense, we are talking about the flat prior. This is called flat prior. Flat, there is not any influence. There is not any anticipation that yes, these people are having certain chance of that diabetes. No. So background of that, we are assuming everybody will be having equal chance to either having diabetes or not having diabetes. So in that sense, if we make this y-axis up to 100%, this y-axis as a 100%, so that possibility for each person stand with the equal possibilities, that is a 50% possibilities that any person can become diabetes and non-diabetes. Now once we are having, let's say now or cancer rate, same kind of story is there. Now once we are having the data, once we say that okay, we are having 300 people data and out of that 300 people, 45 that we see that is having the diabetes. So then we can plot the data, we can plot the distributions, and distributions is not always to have the normal distributions, or let's say for the time being, we assume that let's say there are also some certain type of normal distributions are following. Yes. Any? Okay. Now, so while you are talking about the 45 out of 300 people having diabetes, or let's say cancer rate is 15%. Yes. Yeah. Correct. So now let's say now we can get that posterior distribution as a 15%. I'll make that what is the difference between prior distribution and posterior distributions. The fundamental thing is that we priorly assume that everybody will be having either diabetes or non-diabetes, so that is a 50% prior value we are assuming. But once you get the data, once you are having the 300 people data, then let's say our cancer rate or diabetic rate, we are getting the 15%. So then we are coming to the realistic figure, that is as a 15%. These 15% are basically called as a point estimate. Similar point estimate concept we will also get in the confidence interval regime. So they are also we call as a point estimate. It is nothing but taking the simple percentage. That's all the point estimate. Now the beauty of this credible interval or difference with the confidence interval, that how we are making the confidence interval or credible interval. So we will come. But here the credible interval is that a range of values that represent a given level of possibilities. Where we are, in case of confidence interval, we are talking about 95% and rest of that we are making. But here, with all possibilities, with the given possibilities, we are giving the range. So that's the difference. And that range coming with the, that's called the posterior distribution. So 15%, we are not giving only 15%. 15% also given by confidence interval concept. Here also we are giving the 15%. But there 15% plus minus standard deviation would give us the confidence interval. But here that will not come. Here the way it is, we are going to ask if our data is 50% or the prior is 50%, or everybody is having equal chance to have either diabetes or non-diabetes, or cancer or not cancer, then along with that we are also going to get the interval. And the intervals comes, how it comes, it's not about the sample data we are having and making the standard deviation. Concept of this confidence interval again, mean plus minus standard deviations. But here we are asking our data if it is 15%, and then, and if it is a follow particular distribution with the 50% distributions, what kind of distribution is going to get? If it is going a particular distributions, let's say it is coming from beta distributions, binomial distribution, a number of distributions are there. I am not going in details. But if it is particular distribution, along with that distributions, what is the standard deviations going to come? So fluctuation of that distribution we are talking, not about the data, because in case of data, confidence interval, we are extrapolating it, but here we are not extrapolating it. Here we are distribution stock we are talking. So here we are having the options like 5 to 30%, 31%, let's say. So 5 to 31% comes and it's covered the 15% regime. So below range is 5%, above range is 31%, and then we say our credible interval is 5 to 31%. And along with the credible point estimate as a 15%. So that's the way. Now if we say that what is the chance of this 1%, it's very rare. Or what is the chance of let's say 90% and above to having the cancer or breast cancer diabetes rate? It is very rare. So in that sense, this value gives us another opportunity to overcome the rarest event. Now see, it's quite logical to make the credible interval adjust based on our subjective way. If we talk about the credible interval, we can say that what is the 90% possibility that maximum number or up to 29% people are having diabetes or cancer, any example. So it stand with, so the flexibility is there. We are just shifting to the left hand side entire regime, and here also the 15% comes, point estimates comes, but it's making the 0 to 29%. So what happened? So if we think that as far as our data is concerned, we can think that, for example, what is that? One another example could be that what is the males are having the pregnancy rate. Correct. So it can be 0. That 0 value, ideally it can consider 0. But in other cases it can't consider 0. In other consequences, other application it can't consider 0. So if the example is that this value can consider also the 0, subjective wise it can consider also 0, then we can fix our credible interval from 0 to 29. Otherwise not. Maybe another good example could come out, but one other way we can make it. So it's depend on subjective probability, subjectiveness we can incorporate over there while you are talking about the credible interval. Similarly, so it seems 100% diabetes, another way, getting the 100% diabetes rate or cancer rate is quite impossible. But if we can, our data can give us that 9 to 100% probability also. That is possible by applications of the credible interval. Now we are having the choice. So getting the 5 to 31%, getting the data with 0 to 9%, and getting the data with 9 to 100%. Look, one thing, while you are talking about 9 to 100%, our range is becoming wider. While you are having wider range, people are going to less rely on that range. if you are having the stringent rate, very narrow range, if we say our range of credible interval, let's say point estimate is 15%, and let's say this is stand between 10 to 20%. So it is quite reliable range, rather than if we say 5 to 85% range. So as the range becomes higher, we are going to avoid that results. If the range is very narrow, then we are going to consider that range or that outcome of the results. Credible interval gives us that opportunity. It's not only rely on the 95%. 95% confidence interval gives us the only single value, and we don't have that choice to overcome it. But here, credible interval, we are getting different choices of that intervals. 5 to 31, 0 to 9 to 29, or let's say 9 to 100%. So as far as the subject things are concerned, if we think that yes, 0 to 29% is logical and we should consider it with our example, we may consider it. Otherwise we think no, it's not quite logical. 5 to 30%, 31% is quite logical, so we can also consider it. But one thing is that we are not changing anything with the 15% point estimate. That is going to be remain same. So, but one thing is that one terminology here we used, if we, the lowest intervals we are talking here, the credible interval, it is termed as highest density interval. It is highest density. The narrowest one is called the highest density interval, or sometimes called as a highest posterior density interval. The narrowest credible interval for a given level of possibility is called, and the highest density interval, and it also includes the possible all values. Okay, so these are the more or less things with these credible intervals, and obviously we can consider this 5 to 31% intervals as an credible intervals with highest posterior density interval, and rest 10% we can left that is not possible, not going to happen. So in one characteristics, one population, if we talk what is the cancer rate, it may be beyond 31% or below 5%, it is having 10% possibilities. So we can say it is 10% possibilities to having cancer rate or diabetes rate, whatever you say, it is more than, it is 10% possibility, and rest, it will be become 5 to 31%, it is 90%. So that's the way it works. Now I gave the example with the 90%, the similar concept can be applied with the 95%, and that will be called as a 95% credible interval. So that's the way it's, the conceptual things are there. Now there are techniques are there to get the credible interval estimates. Particularly in next sessions, I will touch about the how to make the survival analysis credible intervals over there. So that's all. So now I think, yeah, so we are on time.
Oh,
yes.
We will take some questions.
Yes.
Yeah, go ahead. Just use that mic. It's working?
Yes.
Then you would be audible there, but you won't be audible on Zoom. So use this.
So how will you estimate that 5 to 31 or 0 to 29? How will you, based on what we will define those intervals?
Correct. That I mentioned that it's say the 5 to 31 should we rely. One thing is that objectification is there because this we are having different choices of interval, and among different because these estimates the procedure will give you different intervals. Okay. Now blindly you can choose the interval that is the narrowest one, smallest one. So right now we are getting 5 to 31. Otherwise, let's say we are getting 12 to 18%. This is the narrowest one. So blindly we can consider this is since it is the narrowest one, we are going to consider it. That is the one way. Secondly, another question you are having that should we consider 5 to 31 or 0 to 29? That comes with the subjective way, because you have to incorporate the subject knowledge is there. If you think just the male's pregnancy rate, so if you think the 0% could be there, could be remain there, then obviously we can rely on the 0 to 29%. That opportunity is there in the credible interval, not in the confidence interval range.
I'll simplify further. So first of all, there were two concepts which were discussed. First was confidence interval. So confidence interval is which most of you would be knowing. Let's say that I have a data of 100 patients, and out of them at 5 years, 60 patients are surviving. I would say at the end of 5 years, there is 60% survival rate. Okay. let's say that Ravi has a data of 200 patients. Out of them, at the end of 5 years, 40% patients are, let's say 80 patients are surviving. So 80 out of 200. So his 5-year survival is 40%. The common question we would get is my survival of 50% in 100 patients better than his survival of 40%, which is shown in which is shown in 200 patients. Now, how do you decide? So what we do is, whenever you give a number, let's say frequency, let's say that this guy has a database of 10 patients, and in him, out of 10 patients at the end of 5 years, 6 patients are surviving. So his stands 5 years survival of 60%, I stand at 50%, he stands at 40%. Now, how do you compare this? So we must understand that if we are going to go and say that a significant value is 0.05, we don't only compare the frequency. This is frequency, 5 year, 40%, it's frequency. We look at the boundaries. So how much this data would vary from different data. So if you do this again and again, how much this would vary. And for that verification, we would use standard error of proportion in this situation. So let's take this example, 10 patients, 6. So 60%, 40%. The standard error proportion is root of P into Q upon N. So root of 60 into 40, 2400 upon 10. That leaves you value with 240. So root of 240. So how much would be root of 240?
Let's say around 2.4%, let's say. Sorry, 24%.
Let's say that root of 240, so it's 15 is 225, let's say 16? 16.
Yes.
So you got standard error proportion as 16. So his 95 confidence interval is 2 multiplied by this. So that is 16 aya. We multiply that by 2. Exactly it is 1.96. Let's multiply by 2. So it's 32. So his data, it can vary from plus
92.
minus 32.
Yes.
So the 60 can be plus minus 32. So let's say 30. So it can vary from 30% to 90%. So my data is falling in that range. So the P is not going to get significant. His data is also. So same way if you look at my data where I got 50. So 50 into 50, that is 2,500. Sample size was 100. So divided by 100, I am left with 25. Root of 25, that will be 5. Multiplied by 2, 10. So my data can vary from 40 to 60. His data is of 200 patients. So that will be 40 into 60, 2,400 divided by 200. That is root of 12. That will be 3 point something. So his data will vary only by 6. What we understood? We understood that when you are trying to calculate confidence interval, it's not only a function of your success and dissuccess, it's a big function of your sample size. And when you are trying to compare, just knowing that his is 5 years, 60%, 5 year 50, 5 year 40, that is insufficient. You need to know the denominator, and that's the way you do for confidence interval. So we are clear with confidence interval. The concept which Atanu touched upon is actually a brilliant concept called credible interval, and this is used in Bayesian statistics. Now, let me take you to a situation where you would like to use credible intervals, applications where you would like to use credible intervals. Like for example, I am a medical oncologist. I treat patients who fail on therapy, who fail after surgery, who fail after radiation therapy. And today, let's say that there is no treatment. I am sending all patients home. I want to try some 4 or 5 new drugs which I have got. I don't know what is the chance that if I give this drug, the patient will respond. I don't know, because today I am sending them home. You're understanding? So I don't know. So in that, I will assume. So I'll have to make some assumption. Ki itna aata hai to better hai. Okay. Let's say that I assume that 20% if it is that is good, and give some confidence. But that assumption may fail. You may get something else. So at that time, we use this concept of having something called as anterior.
Posterior distribution.
Yes, posterior distribution. So you assume something, and then you actually give the drug and see what it comes. But how do you then decide what is your success or failure? That success or failure will be dependent upon these intervals which you would already have defined it. Okay, you are understanding? So you don't know what would be a success or failure. You know that the chances that the drug may have 0%. There is very unlikely chance that the patient has failed twice. You are giving it in palliative setting that you will get 100% response rate. You think that 20% is okay. So I would say, I would keep this, let's say 10 to 20%. If it crosses this 20%, I would say that the drug will be successful. Okay, so understand that credible interval is a advanced concept. It's different from confidence interval. You would like to use it when you don't have prior knowledge about the distributions in such kind of technically changes. We'll learn more about how to use the credible interval when he shows you the survival curves. You'd like to add anything else?
Yes, yes. One thing is that in that context of this good example, the first example with the 40%, 50% and 60%, the similar things can be adopted even in the with the credible interval also. Let's say that he said that 40% comes around 40 plus 3, 43 and less 33, 37 to 43 range. And 50% comes around, let's say 40 to 60, and 60% come up to 90 to 30%, something like that. So in that sense, these are looks different, percentage wise, point wise, 40, 50, 60 looks different, but they are sharing the common region, basically from 90 to 30%. That's why we are saying all these things are similar. But it's not similar. You know that 40 is separated than 50% and 60%. So what happened? We asked the data, if your data, 40% data, is following certain distributions. In earlier cases, we are saying all these three distributions are following same distributions. And that is one of the limitations. But we are saying your population is different than his population and other populations. So your data is supposed to follow particular distribution, his data is particular another distribution, and his data is follow another distribution. So in that context, we can narrow down our confidence, that interval range. So in that case, 60%, 90 to 30% would not be there. It will be bring down, reduce it, let's say from 55 to 65%. 50% could also come down to 47 to 53%. And 40% could also come down 37 to, let's say, 47%. I'm talking about very optimistic way, but it's happened. So then we can make the difference. They are different in nature.
So what Atanu just told you is, when we gave the example of 60, 50, 40, we made a big assumption. The assumption was all data followed normal distribution. Understand, in statistics, when you use any test, you need to test for assumptions. And most of the assumptions assume that normal. Let's say that his distribution was something else. Then these formulas don't hold true. That's why what he's telling you is that you look at the distribution. So if you use the confidence interval method, assuming that the data has normal, in this example which we get, you cannot make a sense. You would have to conclude that all three have similar survival. But if you want to still look into the data closely, you can look at the distributions, how the distributions are different, and if the distributions are different, you could use credible interval and still make some sense of the data to give you some early indicators. Is his outcomes actually better than our outcomes or not? Anyone has any questions? Yeah.
What is the difference between assumption and hypothesis?
Okay. Hypothesis, I would say it's a quite straightforward statement. But assumptions gives us so many opportunity to consider with the distribution. So hypothesis never gives us the opportunity to consider the distribution, data distribution. It's a single statement. But assumptions gives us the opportunity to consider what should be the data distributions. That's the difference.
So he is putting it in statistical sense, where hypothesis would be superiority, non-inferiority.
Correct.
So you would say that, okay, this would be better than this. Assumption is that you assume this would, how much better? Let's say I got a drug X, he treats the patient with drug A. I want to say that X is better than A.
That is assumption.
That is assumption. To say that the A will be better than X at 2 years by 15%. that will be the complete
Statement that is hypothesis.
hypothesis. Okay. Any further questions? Anyone else? You can ask any question. No issues. Yeah.
But if we are supposed to frame a hypothesis for a paper, and can we use the posterior distribution as a hypothesis?
Okay, very good question.
Yeah.
Very good question. No, posterior distributions can't be considered in the hypothesis. Posterior is the outcome of basically posterior distribution used to get the outcome. So outcome could be, or the hypothesis could be, the credible interval concept. Posterior distributions, no. I would say it's a intermediate method. It's a tool to get your credible interval. Don't say as a posterior distribution, put it as a credible interval or at the most point estimate. It's a process and it's posterior distribution helps to get that outcome.
Posterior distributions are what come after your data you have seen. So I want to say that my drug X will do something. So anterior is something I assume. Posterior is when I already have the data, I see that, and what distribution I get, that is the posterior distribution. So you can't have posterior when you are writing your protocol or framing your hypothesis. Okay?
Yes, yes.
We'll move to the next lecture.
Okay,
Atanu.
okay. I think next lecture